Hola, buenos días, buenas tardes a todos y todas. Bienvenidos a la primera conferencia de prensa en 2022 de la Organización Panamericana de la Salud, la OPS, sobre la pandemia de COVID-19 en las Américas. Soy Luciana Viegas, asesora de Asuntos Públicos en la OPS y hoy es miércoles 12 de enero de 2022. Como todas las sesiones anteriores, contamos con interpretación en inglés, portugués y francés. Se encuentran en el botón Interpretation. Podrán también, claro, hacer preguntas durante la sesión a través del botón Q y A. Y también hemos recibido preguntas por correo. Muchas gracias y empezamos con ellas. Recuerden, por favor, los periodistas identificarse con su nombre y medio de comunicación al enviar las preguntas. Hoy la doctora Carice Etienne, la directora de la OPS, les actualizará sobre la situación de COVID-19 y el avance de Omicron en las Américas. Acompaña a la doctora Etienne el doctor Jarbas Barbosa, subdirector de la OPS, el doctor Ciro Ugarte, director de Emergencias en Salud de la OPS, y el doctor Silván Aldiguere, gerente de incidente para COVID-19 en la OPS. Paso ahora, invito a la doctora Etienne para compartir su discurso de apertura y darnos sus palabras. Dr. Etienne, please.
Thank you, and good morning. Let me wish each of you a happy new year. And thank you for joining our first press briefing of 2022. Since the start of this pandemic, nearly 300 million people around the world have been infected with COVID-19. And the virus has quickly picked up pace over the holiday season, reaching levels of transmission never seen before during this pandemic. Over the past week, COVID infections have nearly doubled in the region of the Americas, rising from 3.4 million on January 1st to 6.1 million on January 8th. To compare with last year, during the week ending January 8, 2021, the Americas had reported a total of 2.4 million cases, while this year, by the same date, there were 6 million reported cases, representing a 250% increase year to year. Infections are accelerating across every corner of the Americas. And once again, our health systems are being challenged as emergency room visits and hospitalizations are rising. Nonetheless, thanks to the protective power of vaccines, in fact, COVID deaths are not rising with the current wave of infections. The United States is reporting the bulk of new cases, where its eastern and Midwestern states are experiencing a rapid surge. In Canada, cases are also picking up speed in its eastern provinces. In the Caribbean, Puerto Rico and the Dominican Republic are reporting the highest numbers of new infections. Although other islands like Jamaica, Aruba, Curacao, and Martinique are also seeing significant jumps in COVID cases. Meanwhile, Belize and Panama are reporting the highest incidence of COVID in Central America. Further south, Bolivia, Ecuador, Peru, and Brazil are experiencing significant increases in new cases. COVID hospitalizations are also up throughout Brazil, particularly in densely populated states around the central and eastern parts of the country. In Argentina and Paraguay, COVID infections have increased by nearly 300% over the last week. Today, of course, all eyes are on Omicron, which has reached nearly every country in the world. 42 countries and territories in all subregions of the Americas, North America, Central America, South America, and the Caribbean have already detected the Omicron variant. Since countries are already experiencing widespread community transmission, as Omicron spreads more quickly than other detected variants, and more likely via airborne transmission in closed spaces. And while Delta is still causing new infections in the Americas, based on current trends, Omicron is on track to become the dominant strain in our region. It also has led to a rise in reinfections, even among those who are fully vaccinated. This new wave of infections, it won't be mild for our health systems, as the Omicron variant is already challenging our health workforce and limiting care for other diseases. In smaller island states, some hospitals were already strained by cases of the Delta variant, and now more hospitals face the prospect of being overwhelmed with cases. One of the characteristics that sets Omicron apart seems to be less severe symptoms. But even so, Omicron infections can be lethal, especially for the immunocompromised and the unvaccinated. So the time to act is now, using the many tools that we now have at hand. Prioritizing symptomatic individuals for testing and making rational use of these resources is critical to catch infections quickly and early. Maintaining and reinforcing the public health measures is paramount to slow transmission. The PCR and rapid antigen tests recommended by PAHO remain effective at detecting the Omicron variant. So countries should continue to use existing protocols with rational use of tests. PAHO's strategic fund makes COVID tests available at low prices, so countries should take advantage of this resource. Vaccines are especially important as Omicron takes hold. Countries in the Americas have been working diligently to secure the vaccines that they need to protect their population. And thanks to their efforts, nearly 60% of people in Latin America and the Caribbean have been fully vaccinated with 2 doses. And many countries in our region, like Chile, Cuba, and Argentina, have some of the highest vaccination coverage rates in the world. Vaccines are helping to save lives, and expanding equitable coverage everywhere remains our priority. WHO's expert group, the SAGE, has also called for vaccination strategies optimized for prevention of severe disease, including the targeted use of booster vaccination. This applies to people at high risk of complications and healthcare workers who are more exposed to the virus. We must continue to protect our health workers. Our region's ability to respond and overcome this pandemic depends on men and women who staff our primary healthcare centers, clinics, and hospitals. As health professionals everywhere handle the influx of new cases requiring immediate care, we must make sure that they are protected from the worst consequences of this virus. Wherever enough vaccines are available, health workers should be prioritized for an additional COVID vaccine dose. Additional doses are safe and effective and will help reinforce health workers' ability to withstand exposure to the virus, especially now that infections are rising. 39 countries and territories in the Americas have been rolling out additional doses to ensure their populations, including health workers, remain protected. But protecting our health workers cannot stop there. We urge countries to ensure that they have the right protective equipment so our health workers can do their jobs safely. With a virus as transmissible as this one, effective and well-fitted masks help us all stay safe. So we urge countries to provide their health workers with the PAHO WHO recommended protective equipment, including masks with the highest filtration capacity. While COVID continues to spread in our region, we remind everyone that our goal has always been to protect each other from the most serious symptoms so we can save lives and prevent deaths from COVID infections. And saving lives remains our highest priority. Once again, we must slow down new infections to avoid overwhelming our health systems. Governments must act guided by evidence to limit new infections. And we all have a personal responsibility to keep each other safe by following proven public health measures like mask wearing, social distancing, and avoiding large gatherings, by getting vaccinated when it's our turn, and by getting tested if we suspect that we are sick. Our collective actions against this virus have the power to change its course. Whether we are fighting for vaccine equity, supporting our health workers, or doing our part to reduce the risk of transmission, solidarity will pave our way out of the pandemic. Thanks for listening.
Thank you very much, Dr. Tien. We start with a general question that we received from a couple of media. As we enter 2022 and the third year of the pandemic, what are PAHO's priorities for the year? Dr. Tien?
Well, let me thank you for this question. For 2022, our priorities are to protect the gains that we have made against COVID-19 in the last 2 years by helping the countries develop their surge capacities to treat patients and helping them continue to roll out vaccination campaigns. Both of these have proven to help reduce mortality in the region. And our challenge now, I think, is to deal with the rapidly evolving situation of COVID-19. We must also, I believe, advocate for maintaining the discipline of the important public health and social measures that have helped limit transmission. The key public health measures we continue to recommend include the use of well-fitting masks, physical distancing, ventilation of indoor spaces, avoidance of crowded spaces, especially during parties or celebrations, and also hand hygiene. This will help reduce transmission of SARS-CoV-2, including its Omicron variant. Because the emergence of new variants is a key factor, we also have to strengthen our virus surveillance systems in the region and to give them the tools to rapidly report any new data to our regional and global systems, such as GISAID or GSAID. Another challenge is to prepare our primary healthcare systems to handle and fairly distribute any new therapeutic or treatments that may become available in our countries. And of course, it is important to continue and to intensify our successful vaccination programs to reach at least 70% and hopefully much more than that of our eligible populations, with rational implementation of immunization protocols, including the additional doses or boosters to protect people at high risk and to protect our health workers. This would require, of necessity, our working with member states to address vaccine hesitancy, which is very present, particularly in the Caribbean islands. Thanks.
Thank you, Dr. Tien. Pasamos a las próximas preguntas. Empezamos con preguntas sobre el avance de Omicron. Deandra S. Hamilton from Magnetic Media, Turks and Caicos, the Bahama, asks again, how many regional countries with Omicron? How does PAHO describe the rate of breakthrough infections due, it appears, to Omicron? And what percentages of cases are Omicron or Delta? And if PAHO is offering any support in terms of testing kits and materials to countries. Dr. Altighieri.
Yes, thank you from this series of questions from the Bahamas. I'd like to mention that thanks to the active participation of most of the national laboratories, public health laboratories in the region, in the PAHO genomic surveillance network, and the sustained efforts of the countries to generate timely data, we have been able to follow the distribution and circulation of different variants, including those of concern and including the Omicron variant. So, although the Delta variant is still predominating in the Americas, and as Dr. Etienne said in her remarks, as of today, Omicron has been detected in 42 countries and territories. Omicron is probably going to become predominant during the next weeks. Regarding the support of PAHO, PAHO has provided testing kits and materials since the beginning of the outbreak, very early 2020, starting February 2020. And PAHO has continually maintained the support to all member states to ensure the detection and the timely diagnostic of COVID-19. Just to provide you with some figures, as of today, in addition of the PAHO strategic funds, PAHO has donated reagents for more than 12 million PCR tests and more than 3 million antigen rapid detection tests. In addition, sequencing materials for the genomic surveillance and molecular screening to detect the variant of concerns has been delivered to more than 22 countries. Another part of the questions. For different reasons, it's difficult to accurately describe and follow the COVID-19 breakthrough. Although individuals already vaccinated can get infected, they are usually asymptomatic or they develop mild disease, preventing them to seek medical attentions and getting tested. Even if a virus is detected, not all cases will be sequenced. So confirming variant in the affected population might be challenging. Evidence shows that breakthrough may occur with Omicron in higher frequency. Nevertheless, it is important to remember that other variants of concerns, including, of course, the highly transmissible Delta, can also infect vaccinated people. Therefore, as we have explained in many other press conferences and technical documents and communications and press release, maintaining public health measures, including social distancing and proper use of masks, in addition to vaccination, is critical to slow down the transmission. I hope I have answered the concerns from the journalist in the Bahamas. Thank you.
Thank you, Dr. Aldigueri. Pasamos a una pregunta de Estefania Escobar, reportera del diario Reforma en México. Estefania pide un comentario sobre la implementación de los pasaportes sanitarios en algunos países, en particular en respecto a la discriminación que podría resultar para algunas personas, restricción de viajes a vacunados con ciertos fármacos no permitidos en Estados Unidos y en la Unión Europea. Doctor Barbosa, quizás puede comentar.
Gracias por la pregunta. La vacunación en la región va progresando. Como habló la directora, tenemos ahora alrededor de 60% de la población vacunada en América Latina, pero hay mucha disparidad todavía. Tenemos algunos países que están entre los países que más vacunan en el mundo. Tenemos a Chile, a Cuba, a Canadá, a Uruguay y Argentina, que vacunaron más de 75% de la población, pero todavía tenemos 10 países que no lograron vacunar los 40% de la población, que era la meta para diciembre del año pasado. Los pasaportes sanitarios ya mencionamos algunas veces. Para eso es necesario tener un acuerdo global de los países para que la OMS y la OPS puedan hablar sobre esa recomendación, puedan hacer esa recomendación. El acuerdo que tienen los países hoy sobre a vacuna que pode ser obrigatória, é a vacuna de febre amarela. E compreendemos por que é difícil alcançar um consenso sobre isso, porque muitos países no mundo não têm acesso às vacunas de uma maneira mais ampla. Então, fazer uma recomendação de passaporte de vacunação, como se está chamando, ou seja, a obrigatoriedade de vacunação pode ser um fator para ampliar a discriminação e a dificuldade de acesso para alguns países. Seguro que essa é uma decisão que toma cada país. Os países que tomam essa decisão têm que recordar que não é uma medida aislada como essa que pode proteger, porque, primeiro, os vacunados também podem transmitir o COVID de uma maneira mais atenuada que os não vacunados, mas também seguem com a transmissão. Então, quando se pensa em proteção para um país, há que pensar de uma maneira muito mais ampla, com medidas que possam efetivamente reduzir o risco de introdução de novas variantes em um país e además, de mirar que resposta se está brindando a cada país. Eu creio que isso efetivamente é muito importante. E a OPS ha sempre planteado que todos os produtores de vacuna possam apresentar sua solicitude de receber a autorização de uso de emergência da OMS. O processo é aberto para todos os produtores que queiram participar, que queiram apresentar seus dados, e isso, sem dúvida, seria uma medida importante para atender mais vacunas ofertadas por el Fundo Rotatório de Vacunas da OPS e também de ter mais vacunas reconhecidas por todos os países do mundo. Gracias.
Gracias, doctor Barbosa. Pasamos a una pregunta desde Venezuela. Kevin Arteaga González, periodista de El Carabobeño. Dos preguntas. La primera, ¿qué tanto ha avanzado la variante Omicron en el país? Y si es la predominante, y también pide un panorama general de la pandemia en Venezuela. Y la segunda pregunta es cómo ha sido el desarrollo de la vacunación en el país tras los envíos de los cargamentos de COVAX. Doctor Ugarte, quizás la primera, el panorama de la situación y la variante Omicron, y el doctor Barbosa después con el desarrollo de la vacunación. Gracias.
Doctor gracias, Ugarte. Luciana. Muchas gracias por la pregunta. Gracias a Kevin. Desde el primer reporte de la detección de la variante Omicron en Venezuela en diciembre del año pasado, se estima que esta variante progresivamente llegue a otras partes del territorio venezolano, como ocurre en la mayoría de los países, y que progresivamente sea la variante que sea la predominante. Sin embargo, como ya lo dijo nuestra directora Silván y Jarbas, el tema es la oportunidad que le damos al virus para transmitirse de persona a persona. Y en la medida que nosotros tomemos las precauciones para reducir ese riesgo de transmisión entre personas, reduciremos también la probabilidad de que Omicron, que es una variante altamente transmisible, tenga un impacto mayor en corto tiempo en los servicios de salud y en la población. En este momento, muchos de los países de las Américas han reportado un incremento significativo de nuevos casos y también de hospitalizaciones y de ocupación de camas de cuidados intensivos, entre ellos Venezuela. Por ejemplo, en la última semana, Venezuela reportó un incremento de 89% de nuevos casos. Si nosotros hacemos la comparación con otras variantes y también otros países, podríamos decir que un aumento significativo o una proporción significativa de este aumento podría deberse a Omicron, pero tiene que confirmarse. De hecho, cualquiera que sea la variante, en realidad es un tema de salud pública que nosotros tenemos que tener en cuenta. Y desde el punto de vista de los fallecimientos, también se ha reportado en la última semana un aumento de 37% de los fallecidos. Con esto no significa que los servicios de salud estén sobrecargados, pero las medidas de protección harán la diferencia, de tal manera que debemos enfatizar en ese proceso para Venezuela y para otros países de la región también. Paso a Jarbas. Adelante.
Gracias, Ciro. Mira, Venezuela ha recibido já 5.875.000 doses de vacunas por el mecanismo COVAX. Siempre que Venezuela ha empezado a participar del mecanismo, estamos en negociaciones, en conversas con el Ministerio de Salud de Venezuela, con los productores, para que todas las vacunas que están asignadas para Venezuela puedan llegar lo más rápido posible al país. Com essas vacinas, casi 5.900.000 doses, e também por intermédio de los acordos bilaterais que tem, Venezuela informa hoje que já tem vacunado ao redor de 40% de sua população. Ou seja, é logro importante alcançar esses 40%, pero há que avançar muito mais. Recuerden que o objetivo, a meta, é ter al menos 70% de la población vacunada hasta el primer día de junio de este año, y con la nueva variante Omicron, tener más acceso a las vacunas, ampliar las campañas de vacunación es todavía más importante. Gracias.
Gracias, doctor Ugarte, doctor Barbosa. Pasamos a la próxima pregunta sobre aislamiento de contactos. Matías Löwy, Medscape en español en Argentina, pregunta: ¿consideran razonable o lógico acortar o eliminar los días de aislamiento de contactos estrechos vacunados, como están proponiendo muchos países en Europa y también en la región, como Argentina? Doctora Alighieri.
Agradezco la pregunta del colega de Medscape en Argentina, pero primero quisiera aclarar que el término aislamiento aplica al confinamiento de casos de COVID-19, mientras para el confinamiento de los contactos de esos casos se aplica el término de cuarentena. Así que entiendo que la pregunta se refiere a la cuarentena. Desde junio de 2021, en los lineamientos técnicos de la OMS, en lo que corresponde a la cuarentena, se han contemplado contextos y situaciones en las cuales se justificaría considerar ajustes al periodo de cuarentena de contactos en términos de acortar su duración por debajo de los 14 días. Es importante, como lo hemos destacado antes en otra pregunta, es importante mencionar que tanto las medidas de protección personal como el distanciamiento físico y social siguen siendo imprescindibles en cualquier estrategia de respuesta ante la pandemia. Entonces, el plantearse ajustes al periodo de cuarentena implica fundamentar el proceso de decisión en un abordaje basado en riesgo, a través del cual se tienen que sopesar los riesgos y los beneficios para la salud pública y los servicios de salud frente a los riesgos sociales y económicos. Quisiera destacar, en un contexto actual bastante desafiante, que es caracterizado por la rápida propagación de la variante Omicron y su impacto en la capacidad de mantener las infraestructuras esenciales funcionando, incluyendo las bajas laborales asociadas con la observación de la cuarentena. Por lo cual, en este contexto, se justifica que se escudriñen opciones para adaptar las estrategias de respuesta nacionales en términos de reducción del periodo de cuarentena, tomando su decisión en base a varios factores, en base a lo que se considera aceptable por partes de las comunidades, en base a los recursos disponibles en términos de capacidad de testeo y diferenciando abordajes para individuos vacunados, quiere decir con menores probabilidades de necesitar atención hospitalaria, aunque se infecten, y los individuos no vacunados, que conllevan un riesgo de sobrecargar los servicios de salud en caso que se infecten. Y fundamentalmente en base al riesgo que se considere aceptable por las autoridades nacionales. Entonces, espero haber respondido a la pregunta del colega de Medscape. Gracias.
Gracias, doctor Aldigueri. Pasamos a una pregunta sobre restrictions, increasing restrictions en inglés. Y es también is a question we received from a reporter, Jasmine Brown, from the Bahamas, our news broadcast reporter, but also from other journalists. We are receiving a lot of questions, journalists. I'm sorry, we have to condense, sometimes combine them into other ones. So BBC Mundo also asked this question related to this about increasing restrictions. Jasmine asks, yesterday, the government in the Bahamas indicated that is looking at increasing restrictions. What is PAHO's recommendations for small countries like the Bahamas, especially seeing huge spike in cases due to the Omicron variant? And she asks a second question. The CDC has warned against cruise ship travel, even for the vaccinated, for countries like the Bahamas that rely heavily on tourism. What is, that is a problem, of course. What is PAHO's view on cruise ship travel, or travel in general, perhaps? We can broaden that, given the global surge of the Omicron variant. Dr. Ugarte, perhaps you want to take a stab at that question?
So much. This is highly relevant, as you said, for many countries, and particularly in the times of Omicron. Regarding the Bahamas, the samples have been sent for genomic sequencing, and the official response is on its way to the country. But according with the epidemiologic situation, but also that has been highlighted also by the Minister of Health of the Bahamas, and PAHO, it is highly probable that the samples will turn out positive to Omicron. So it is highly important also to recognize that the spike of new cases in many countries, including the countries in the Caribbean, and because of the situation of the health services that were already overwhelmed, and the situation of the healthcare workers, and the probability of dramatically increase in the transmission, this type of measures have to be taken into consideration with an cautious approach. So PAHO has been always urged utmost caution, and even considering resuming cruise ship traffic, because of the very specific and still poorly understood dynamic of the spread of the virus on board cruise ships, for example. So in regarding to national authorities, our recommendation has been to proceed in a progressive manner, and on the basis of clear operational and administrative agreements that they have with the tourism industry. And therefore, in the context of intense transmission due to the Omicron variant, as we have highlighted several times, it seems just logic, judicious, that suspending or at least limiting the cruise ship traffic as an outbreak on board might end up exceedingly high, and probably will go beyond the capacity of the local health services. It is a very cautious approach. We need to balance, of course, what is the economy, what is the well-being of the population. At the same time, we have to continue saving lives and reducing the impact in all sectors. Thank you.
Thank you, Dr. Ugarte. Pasamos a una pregunta sobre el virus Omicron desde México. Blanca Valadez de Milenio pregunta qué letalidad y RO tiene Omicron. ¿Es similar a una simple gripa? ¿Y qué panorama advierte la OPS en México? Y también pregunta qué hay de la combinación de variantes Delta y Omicron. Doctor Aldigueri.
Sí, gracias. Yo creo que tenemos tres grupos de preguntas de ámbito un poco diferente. Yo voy a agrupar mis respuestas. La evidencia disponible hasta el momento muestra que Omicron tiene una capacidad de infección hasta 3 veces mayor a la observada con Delta, que hasta ahora hasta diciembre, tenía la mayor capacidad para transmitirse. Sin embargo, al parecer, Omicron no tiene una mejor capacidad intrínseca de transmisión y la rápida expansión de Omicron se debe más bien a su capacidad de evadir la respuesta inmune, generando así infección aún en pacientes vacunados o en pacientes previamente infectados. Asimismo, los datos obtenidos hasta el momento en diversas regiones del mundo, incluyendo en las Américas, indican que Omicron no genera una enfermedad más grave o más letal, y las hospitalizaciones o muertes por Omicron en pacientes con el esquema de vacunación completo son mínimas. No se trata de ver a Omicron como una simple gripa. Es importante tener en cuenta que aún tenemos muchas personas que no han recibido la vacunación completa y principalmente en aquellos con alguna comorbilidad. Una infección con Omicron puede llegar a ser grave o muy grave. Por lo tanto, no debemos relajarnos en este momento y debemos mantener todas las medidas de control y distanciamiento. Otro grupo de preguntas. En lo que corresponde a la situación en México, estamos observando una curva de crecimiento exponencial de casos. Ayer, 11 de enero, se llegó a nivel federal a una cifra récord con más de 33.600 casos nuevos y también un récord de casos activos con más de 70.000 casos activos esos últimos días. Y en México, de acuerdo a los análisis de la Secretaría de Salud a nivel federal, se prevé una cuarta ola superior a la tercera y comparativamente a la misma época en 2021 se observan mucho más casos. Finalmente, y respecto a la combinación o recombinación de Delta con Omicron, quisiera pedir mucha cautela en la interpretación de la información que está circulando en algunos medios. Y aunque pueden haber casos de coinfección o de codetección de las dos variantes, en este momento no podemos hablar de recombinación. No se ha demostrado que este fenómeno haya ocurrido y se está investigando si los reportes que han circulado recientemente se deben a una contaminación de laboratorio u otro tipo de artefacto. Seguramente tendremos más datos en los próximos días, pero no es una preocupación en este momento. Espero haber respondido a las preguntas de la colega del Milenio. Gracias.
Gracias, doctor Aldigueri. Pasamos a una pregunta desde Guatemala. Daniel Collín, TN23, pregunta: Guatemala reportó la presencia de la variante Omicron. ¿Cuál es el escenario que se prevé, tomando en cuenta que un buen número de la población, en especial los jóvenes, no desean vacunarse? Doctor Ugarte.
Muy bien, de acuerdo. Bueno, durante la primera semana de este año se ha observado un incremento muy significativo de casos, de casi 185% de los casos con relación a la última semana del año pasado. Como ya lo han dicho los colegas de la OPS anteriormente, este incremento se ha debido a que han habido muchas más oportunidades de transmisión debido a las fiestas de Navidad, de fin de año, de vacaciones en muchos lugares. Y por supuesto en esas condiciones se han incrementado los casos. Y las proyecciones indican que en Guatemala podría enfrentar un incremento de nuevos casos que podría también incrementar las hospitalizaciones, y sobre todo en población no vacunada, como es lo que se está observando en muchos otros países. De tal manera que para reducir la transmisión y el impacto, la Organización Panamericana de la Salud sigue recomendando acelerar la cobertura de vacunación contra la COVID-19 en todos los grupos de edad, y en la población que es susceptible a tener cuadros moderados o graves de la COVID-19 y, por supuesto, continuar con las medidas de salud pública. Estas medidas que nos tienen a casi todos cansados de seguir usando mascarillas, cansados de no estar cerca a nuestros familiares, cansados de salir a la calle y compartir con otras personas. En realidad, esa es la medida que ha protegido. Y aún en poblaciones donde hay una alta vacunación, esa relajación de las medidas ha demostrado que el virus encuentra la oportunidad para transmitirse y, por supuesto, ese aumento significativo de casos se ha presentado también en Guatemala, donde la positividad de casos ha aumentado de 6% al cierre del año pasado a 18% a inicios del 2022 y seguramente continuará incrementando esta positividad, es decir, la proporción de muestras que salen positivas en este año. De tal manera que es muy importante que la población que se siente que puede quizá tener más resistencia al virus, como la población joven, la población adulta, que no tiene otras enfermedades concomitantes, se vacune. Se vacune por su propia protección, porque sería demasiado tarde cuando estén cuidados intensivos. Hay muchos casos de jóvenes y de adultos que no quisieron vacunarse siguiendo cualquier orientación que hayan recibido de cualquier fuente, pero cuando les toca a ellos o les toca a su familia, se dan cuenta que la vacunación es la medida más importante de protección contra la COVID-19 y deberíamos incentivar a los jóvenes y a los adultos jóvenes a que se vacunen, porque de ellos también dependerá que los servicios de salud y que esta pandemia esté controlada. Gracias.
Gracias, doctor Aldigueri. Pasamos a preguntas desde Nicaragua. Tenemos dos periodistas, por ejemplo, Kelly Romero de Conferencia y también Lidia López de la prensa. Quieren saber cuál es el avance de Omicron en Centroamérica y qué está haciendo Nicaragua para detectarlo. Doctor Aldigueri, si tienes alguna información.
Y con mucho gusto, como seguimiento, actualización a varias conferencias de prensa antes del periodo navideño. Quisiera destacar que gracias al trabajo continuo y el esfuerzo del Laboratorio Nacional de Salud Pública del Ministerio de Salud de Nicaragua, Nicaragua ha generado un sistema de vigilancia genómica que le ha permitido demostrar la circulación de diferentes variantes, tanto de interés como de preocupación, y tiene por lo tanto toda la capacidad para realizar la caracterización de la variante Omicron. Además, yo creo en el mismo enfoque que comentarios previos en otras conferencias, tenemos que utilizar un enfoque subregional. Y además de Nicaragua, es importante mencionar que gracias a esfuerzos de Guatemala, de Honduras, de El Salvador, de Belice, de Costa Rica, de la República Dominicana, y quisiera destacar la colaboración muy proactiva del Instituto Gorgas en Panamá, ha sido posible mantener la vigilancia de variantes y la detección oportuna de Omicron en América Central. El Instituto Gorgas en Panamá funge como laboratorio de referencia subregional para la red de vigilancia genómica. Por eso resaltamos la importancia de mantener y fortalecer una vigilancia genómica sostenida en América Central que nos permita detectar a tiempo la introducción y la diseminación de diferentes variantes. Y podemos asegurar que la Organización Panamericana de la Salud seguirá trabajando de cerca con todos los Estados miembros para incrementar cada vez más la capacidad diagnóstica, incluyendo las plataformas de vigilancia genómica de la región. Gracias.
Gracias, Silván. Tenemos una otra pregunta desde Nicaragua, de Confidencial. Pregunta para el 2022. ¿Está previsto que Nicaragua siga recibiendo vacunas a través del mecanismo COVAX? Si es así, ¿cuál es la cantidad que se donará? Doctor Barbosa, si tiene alguna actualización.
Sí, gracias. La vacunación en Nicaragua está avanzando mucho. Recuerden que Nicaragua estaba hace un par de meses entre los países que no había alcanzado sequer 10% de vacunación. Hoy, Nicaragua ya ha recibido 4.200.000 dosis de vacuna por el mecanismo COVAX. Además de esto, también Nicaragua tiene acuerdos bilaterales y ha utilizado la alternativa de adquisición directa por el fondo rotatorio de la OPS, incluso ya enviamos vacunas por esta alternativa para Nicaragua en diciembre. Así que Nicaragua hoy está ya con 45% de la población vacunada, lo que es importante y hay que avanzar más. La OPS está trabajando con el Ministerio de Salud, buscando incluso estrategias más avanzadas, como la vacunación casa a casa, em áreas onde há uma baixa cobertura vacunal. Assim que eu creio que isso é um bom exemplo de quando se tem acesso às vacunas e se tem bom plano de vacinação, se pode avançar muito rápido. Gracias.
Gracias, doctor Barbosa. Nos quedamos con las vacunas. Una otra pregunta desde el Caribe en inglés. Deandra Hamilton from Turks and Caicos, what is the plan to get Caribbean, Latin American countries at 70% by July, as set out by WHO? That's question number one. Question number two is regarding sort of the practice where shots in arms will be as frequent as every 2 to 5 months. That's sort of a trend at the moment, and it has been described as unsustainable. What is the future of vaccination looking like in this ongoing response to COVID-19? Dr. Barbosa.
No, thank you for this question. We are concerned with the Caribbean. In many press conferences, we have called the attention about the situation in the Caribbean, because we have experience in the Americas, in the United States, but also in the Caribbean, some very important movement against the vaccine, some vaccines hesitancy that can be a barrier, very important barrier to have the people accessing and getting the vaccines that they need. As a result, we see that we have still 90 countries in the Caribbean that are below 40% of vaccination as vaccination coverage of their population. So we are working with the Ministry of Health. We are highlighting the relevance to have a very comprehensive communication strategy to invite physicians, nurses, academic institutions, community leaders, to be engaged in this vaccination effort. Let's remind people that this is not a regular disease, this is not a regular vaccine. Unfortunately, many groups are sharing every day false news, fake news about the vaccine. So it's very important to go every day to respond to them, to provide clear and transparent information so the families and the communities will be comfortable to make the right decision to get the vaccines. I think that this is very important. The economy in the Caribbean has been hitting very hard for the pandemic, and the best way to recover, to get the tourism working again in the Caribbean, the other economic activities, is to increase the vaccination coverage in the country. So we are working to get more vaccines, to have more vaccines available to these countries, and at the same time, to support the Ministry of Health to get more people willing to be vaccinated. About this trend to have a shot in 2 to 5 months, this is not a recommendation yet. I think that is important that we need to keep with the recommendations that are based in the current scientific evidence that we have. Sometimes we have one study that is saying one thing, that this will happen or not. I think that is very important to have these recommendations that are being produced by the Strategic Advisory Group of experts on immunization that make the recommendation for WHO and PAHO also. What we can say about the future of vaccination is that first, we need to complete the task that we have now. We still have many people to get fully vaccinated in the Caribbean and in Latin America. And second, we needed to monitor the behavior of the vaccines against the new variants in order to make further recommendation in the future. So I think that now we need to complete our task. We need to get more people vaccinated. We need to reach the 70%, at least 70% of people fully vaccinated in order to control the transmission, because vaccines are the best tool that we have working together with the public health measures. Thank you.
Thank you, Dr. Barbosa. The next question about treatment, pills for COVID. A question from Linda Straker from Now Grenada. She asks, recently the FDA approved a pill for the treatment of COVID-19, and she refers to the Pfizer's Paxlovid. Her question is, can PAHO say whether or not is working towards having countries in the region administer this pill for COVID-19? And if there are any pharmaceutical manufacturers that PAHO is working with in the region or supporting that are producing a generic version of it. Dr. Aldigueri?
Thank you for this question. I would divide my answer into two parts. First, what we are doing in terms of new access to new therapeutics, including antivirals, and after what is the regional landscape for the production of generic medications. So PAHO periodically evaluates the evidence regarding potential therapeutics for the prophylaxis and management of COVID-19 patients. At this moment, those therapeutics include monoclonal antibodies, such as Regencov, Sotrovimab, and antivirals, such as Remdesivir, and a combination of Nirmatrelvir/Ritonavir, called Paxlovid, or Molnupiravir, for the management of high-risk patients with non-severe disease. So PAHO is working to provide access to those therapeutics that are currently or that would potentially be recommended. Antivirals will be manufactured through voluntary licensing agreements and made available to some countries based on agreements with the medicine patent pool. Countries in the regions may also produce the product with an agreement with the medicines patent pool. These products can be considered generic products and may be of importance in ambulatory care for vulnerable groups. However, the list of countries would be very limited for the Americas. So in this context, we urge manufacturers to make available the know-how required for the production of antivirals to all countries that need them in time of pandemic. In addition, the PAHO Strategic Fund continues and will continue to negotiate with the manufacturers to make available antivirals of proven efficacy available to these countries that need them. I hope I have answered the question from the colleague in Grenada. Thank you.
Thank you, Dr. Aldigueri. We are sort of coming towards the end of our session, but two more questions we would like to take. One is from Nora Gomez Torres from the Miami Herald. She asks, there has been some confusion regarding the status of the Cuban vaccines. Can you clarify if Cuban officials have officially submitted a pre-certification request for their locally produced vaccines, and in which stage is PAHO's evaluations of the Cuban vaccine, or the WHO's evaluation, I would say. Dr. Barbosa, perhaps you have a comment on this?
Yes, very briefly. First, let's make a clarification. PAHO does not make any authorization or pre-authorization of vaccines. So the WHO, the World Health Organization, is responsible to make the pre-qualification of medicines and vaccines. And during this public health emergency, WHO pre-qualification team, after assessing the vaccines, they are releasing emergency use listing authorization. So it's WHO who is responsible, not the PAHO. Second, it's important to recognize the very important achievement made by Cuban scientists and the vaccine producers, because they developed the first vaccine totally developed and produced in Latin America. So it's important to have this vaccine in this list of vaccines that received the emergency use listing from WHO. PAHO facilitated the contact between the vaccine producers in Cuba and WHO Geneva. They have had 2 meetings so far. They presented some reports from the vaccine. Our colleagues from Geneva clarified the process to them, and I understand that now the Cuban vaccine producers are preparing the dossier that they need to send to Geneva to be reviewed, and after that, Geneva will make a decision. So this is related to WHO. But again, the use of a vaccine in one country is a decision that needs to be made by each national health regulatory authority. So I am telling you how is the process with WHO, but it's not related to a national decision that some countries have made to use this or other vaccines. Thank you.
Thank you, Dr. Barbosa. We are coming to the end of our session for today. I apologize to the journalists that are sending a lot of questions. We unfortunately cannot get to all of them, but we will try to sort of combine them and see that we get it. The last question for today we received from several media, including the Associated Press, Gisela Solomon, and somewhat related from the New York Times, Daniel Politi, the impact of the new variant and the prolonged pandemic and the rising cases, more details on the impact on health services, particularly healthcare workers. Dr. Etienne, this final question for you. Thank you.
Thank you for this question. And really, it is a great preoccupation for us, the possible impact on the health services. So in the first week of 2022, we have seen the highest number of weekly cases since the start of the pandemic. And cases rose by some 77% over the previous week, and deaths jumped by 31%. So there is no question that Omicron is having an impact. At least 17 countries and territories have reported increases greater than 50% in hospital admissions, and including in ICUs. And that is as compared to the previous week. The largest relative increases were in the Caribbean subregion and in Central America. And this is particularly important in the Caribbean, where we see hospital capacity prior to COVID-19 being limited. A number of Caribbean countries, including Antigua and Barbuda, Aruba, Bahamas, Bermuda, Cuba, Curacao, French Guiana, Jamaica, St. Martin, and Suriname, experienced 100% or more relative increases in COVID-19 hospitalization as compared to the previous week. We are also concerned by the fact that several of the countries and territories experiencing these large increases in weekly hospitalization also have a low coverage of eligible population having received a complete vaccine schedule. The impact of these pressures has also been difficult for our health workers who staff the primary healthcare centers, clinics, and hospitals. Let's face it, our health workers have worked tirelessly for 2 years caring for patients. And many of them have gotten sick themselves. And alas, too many have died. They have suffered physical exhaustion. But not only this, we have a study that shows that as many as 22% of health workers in various countries have suffered from depressive episodes. So there is no question that health workers need our support. As we continue to battle the COVID-19 pandemic in 2022, we need to remember that healthcare workers are protecting us, and we also must help to protect them. All of us together, we must work to reduce the transmission of the Omicron variant and certainly all variants of SARS-CoV-2. And we need to do this by ensuring high vaccination coverages. We need to be our neighbors' keepers. Please encourage your friends, your neighbors to get vaccinated as soon as possible. And at the same time, we must adhere to the public health measures that have been so well described, but have proven to be efficacious and effective in reducing transmission of the virus. Let us remember that it is together, caring for each other, that we will stop COVID-19. Thank you very much for listening to us this week, and we shall see you next week. Thank you.
Thank you very much, Dr. Etienne, for those important final words. Colegas, llegamos ahora al final de nuestra sesión de hoy. Quedamos, claro, atentos a solicitudes y preguntas que pueden nos enviar por correo a mediateam@paho.org. Muchas gracias a la directora y los expertos por la sesión de hoy, y planeamos una sesión en la próxima semana también, el miércoles, y hasta allí deseamos todos una buena semana con mucha salud. Muchas gracias.